Hi PulStar doctors, Dr. Maggio here. I wanted to go over some things with you that will save time when you're treating your patients. One of the most common questions that patients will ask you as a doctor is, Doc, when am I done? When am I finished? When am I completed? When can I stop coming in? If they ask you that question, what that means is simply one thing. You, not them, you did not do a good job explaining to the patient what it's going to take to achieve their goal. So let's just make this real simple. When you ask a patient what they want to get out of their care, you need to listen to what they say. It doesn't matter what you want or what you know what's best for them. All that matters is what they want. You'll find that when you utilize that philosophy when treating patients, it reduces a lot of stress in your life. So for example, if you explain to a patient that they can get feeling better with your office, in our field we call that what? Relief care. And if you explain to them that they can get their problem fixed as best as possible, in our office we call that enhanced stabilization. However, in our field that's commonly known as corrective care. You need to simply ask the patient what they want. Do they just want to get feeling better, or do they want to get feeling better and have their problems stable? If they say, I only want relief, doc, I have no desire to do any care after you get me feeling better, your treatment plan with them is real simple. Bob, as soon as you feel as good as you want to feel, don't come in anymore. You can call me when it flares back up, but if your appointments get you feeling as good as you want to feel, cancel the rest of them. I don't need to see you anymore. You don't need any fancy features on the PulStar to help you with that. Obviously, the patients will self-release, but it's real important for you to put that guideline out to them so that they know to let you know that they're done. That way you and your staff does not need to chase after them to find out where they've been. It's very stress-free and easy. Now, what can you utilize the PulStar for as far as for the patients who want to get as good as they can be? Boy, there's a feature that most people are not utilizing on the system that is just flat out phenomenal in order to get the best results with patients. So, if a patient says to you, Doc, I want you to get me feeling better, and I don't want this problem to come back anymore, or I want you to minimize the flare-ups that I have, or I understand how bad my x-rays are, and I don't want to get it any worse, well, that's when you can really utilize the system of chiropractic care. The PulStar system has the database that's built into it. When you're seeing a patient on a visit-to-visit basis, it's extremely important to do the post-scan. Unfortunately, we see that many offices do not do that. They simply scan the patient, adjust the patient, and there's no rescan whatsoever. Why do they do that? They do that because they think they're too busy to thoroughly complete the patient's visit, because by not doing the post-scan, they're saving what? Time. But really are they? They're not. Because what happens is if you don't do your post-scan, you don't have the data to tell the patient how they're progressing. What that means then is that there's no dialogue. In other words, if a person says, I want to get as good as I possibly can be, what are you hanging your hat on? What can you tell them? You can't. Do your pulse scans on the PulStar. That will also give you, remember, the percentage of improvement that improves each visit while you're treating them. You can utilize that number to inform them how well they're doing. So, initially, if a person's real stiff and tight and they have a chronic problem, you might see a low percentage of change, 7, 8, 9, 10%. But as you start loosening them up, obviously, that is going to grow on a higher level. You'll see a 15, 20, 25, 30% change as you adjust them. So that means they went from stiff to looser. Now here's the kicker that most people don't get. As they really start getting better, their adjustments start to hold. The joints stay moving longer and longer, which means as they really hit their peak improvement, the percentage of change after the visit will start dropping. Then it plateaus. Once you start seeing that pattern, you can share that with the patients Bob, this is how we're going to let you know how you're doing. Initially, we want to see your numbers improve and get higher and higher. Eventually, as you start responding, we want to start seeing those drop and then level off. When you start watching the patient's progress and using it in the database, what you're going to find is that simple step is going to save you a lot of time explaining to a patient when they're completely done with their care. And it's amazing how well they'll remember their numbers. It's just like blood pressure or blood sugar or cholesterol. They'll remember and they'll tell you. Put those simple tricks into your practice, utilize the PulStar, and you'll find that it's going to be easier for your patient education on a visit-to-visit basis. Thanks, folks. Have a great day.